So the data is in an open platform. Researchers around the world have access to it. They can look at it. They can learn from it. What are some of the data points that the patients and caregivers need to know? Are they getting into the scientific end of the data, or what, when they go see their oncologist, what data points do they need to be prepared to talk about?
Sure. So there has been genomic profiling of myeloma patients, going on for many years. And there's anywhere from conventional cytogenetics to FISH to gene expression profiling, all the way to sequencing. Now, whole genome and whole exome sequencing is purely experimental at this point. But the older ones should be routinely done, even in a community setting. So what we say to patients is, when they're diagnosed or they have another bone marrow biopsy, be sure to ask your doctor, did you have any, from the results of your conventional cytogenetics or FISH, and again, apparently, from what we understand, at least 80% of community practices are doing this, so even patients who aren't at big academic centers can get these results. What did it say? Did you have deletions of certain chromosomes? Did you have translocations where a little bit of this chromosome switches places with this one? And then if they're a little more sophisticated and do gene expression profiling, you can get information at a deeper level. Why this is important is because precision medicine is still in its infancy in myeloma. But we do know, for example, there are certain chromosomal translocations that were previously called high risk. Those patients didn't do as well. We found out if they're treated with proteasome inhibitors, one of the standards of care, they do just as well as every other patient. So, it's important for doctors to see that, and, for patients, if they're becoming more empowered and educated, to understand, I'm translocation 414, but that's okay, because I should always be on a proteasome inhibitor, and now there's 3 of them. At the other end of the spectrum, the sequencing, we had an earlier genomics initiative launched 10 years ago. We were the first organization working with the Broad Institute and TGen to sequence the myeloma genome. What we found at that time, looking again at the genome at a very deep level, was there was a mutation in something called BRAF, a gene called BRAF,
right,
which is very common in melanoma and also common in other tumor types. It had never been seen in myeloma, and it was just 4% of patients. But amazingly, there's a drug in the market. So if your doctor has access to sequencing, or you're part of the COMPASS study, you're sequenced, you have a mutation in BRAF, you should be on a BRAF inhibitor. So it's incredibly important. Right now there are certain, translocations or deletions or mutations where there is an actionable path. For those that may not there may be nothing actionable that shows up, we say, keep asking and making sure that your doctor is doing this. And when you do have the opportunity to participate in a larger research study, now through our research consortium, we'll be doing whole genome and whole exome sequencing on 500 relapsed patients. So if you missed COMPASS, you still have the opportunity. And then in those results, if there's anything that's clinically actionable, it goes back to the doctor. And within our research consortium, we're opening some trials later this year and into early next year for specific patient populations. So it's really important to ask the question, can I have this done? Because you could be pointed either to a drug that's approved in another cancer or to a clinical trial.